Okay, so today I'm just going to quickly go over how to use the Coronet as an airway clearance device. Coronet is one of the devices that's used at my clinical facility, and it is indicated for patients that have excess secretions as well as a weak cough. So that's patients that have COPD as well as patients with cystic fibrosis and other types of diseases and disorders. So this is Coronet, and the Coronet is a good device to use for airway clearance. On the side you can see there's a dial with resistance from 1 to 4. You usually want to start the patient at 1 and work their way up, but the physician will also let you know what type of resistance that you should use. So this type of airway clearance device should not be used with patients that are pregnant, have hiatal hernia, aortic aneurysm, etc. So to use this device, first of course you do check the physician's orders, and then you also are going to do that assessment with your patient, including all the normals, vital signs, breath sounds, SpO2, etc. You're also going to do your general assessment and look at their physical appearance. So then you need to introduce yourself, you need to explain what you're going to do, and you need to explain how it works in a way that your patient can understand. So this is my Coronet. To use this device, you set your resistance. You have your patient inhale through their nose, not as deep as possible, but deeper than a normal breath. Then they're going to seal their lips around the mouthpiece, and they're going to exhale fully and completely inside the device. The device is going to send vibrations down into the lungs, which is going to break up the secretions in order to move them to the larger airways so that they can be expelled. We're going to do this 15 times per hour. The patients might feel like they have to cough when they first expire into the device, because because that vibration kind of sends a tickle into the throat. So you just need to really try to coach them to continue to exhale as much as possible, so that they're going to get the full effect of the treatment. So then once they've completed their series of breaths, you're going to have them huff cough instead of doing a full expiratory cough. You want them to just do huff cough, because huff cough is going to allow those secretions to get out of the smaller airways into the larger airways so that they can be coughed up and expectorated. And the good coaching is really important with this type of device, because your patient's going to use this device when you're not always present. And so you need to make sure that they don't have any questions on how to use it, and they understand the proper way to use this device. After your treatment, you're going to reassess breath sounds as well as vitals, SpO2, and general appearance. If at any time your patient was in distress, you would immediately stop the treatment. So we use the triple S. You're going to stop the patient, you're going to stabilize the patient, and then the last thing that you're going to stop the treatment, you're going to stabilize the patient, and you're going to stay with the patient. Those are the triple S. So after you've done your final assessment, then you're going to go ahead and let your patient know that they can continue this 15 times per hour, and that you'll be back to check on them periodically throughout the day.